Hi guys, it's Brooke, or RNY for me, coming in with my little update. I told you that I was going to go upstairs and get pretty. Well, I put my hair up, I washed my crevices, and put a little foundation on my face, and we've got to go to my mom's, so I'm not going to get dressed up. Who wants to get dressed up to go to mom's? Not me. But a huge NSV, not huge, but a little NSV for me is this little dress before surgery didn't fit. Let me show you my body. Okay, so this is from Old Navy. Didn't fit before. Now it does. Yay, go me. So anyways, guys, where do I start? I've got a lot to talk about. First, someone texting me, sorry. Anyways, drink. Right now I'm drinking, this is a cup they send you home with. I know, no straws. Sorry people, I have to drink a straw. Anyways, no straws, but it like tells you how much you can drink, how much ounces or whatever. So that's how I've been getting my liquids in. Right now I put lemonade, Kroger brand lemonade in. So anyways, and sometimes I do just regular water. So I'm at, I have lost so many inches this week. This didn't even fit me 3 weeks ago. So that is exciting. I had bought this on a, Facebook. It's like a garage sale app. I bought it for like $2 and I thought, well, I'm gonna have surgery. So, you know, if it fits me, it does. If it doesn't, oh, you know, whatever. It was only $2. It fits me today, people. Woo. Happy dance. I don't know if I posted before that I am down 40 pounds. And I know I'm just going to switch my days to Saturdays, doing an update, because Fridays just don't get it. My husband usually works overtime on Fridays, and I'm usually exhausted from work, so I don't get around to it. Where do I start? Where do I start? So I had reported before that I was in the hospital 3 weeks ago, 2.5 weeks ago. I was having pain. I had TMI, I know, boils, but I had one on my arm, so I wasn't feeling well, so I went to the ER. They sent me home. They did all this tests. I barium swallowing, nothing. CT. I went to work Tuesday morning. I had my normal breakfast, and we were doing a certain part of my job, and all of a sudden I said, man, I don't feel good. Like, I don't feel good. I'm going to go to the bathroom and puke, because usually that's what happens, and I puke. Then I was like, man, I'm kind of constipated. Maybe I got to poop. So I was in the bathroom about 15-20 minutes. Well, I was puking, like dry heaving awful. Nothing coming up, because I had ate like 2 hours before, so there was nothing. So I was drinking some water, excruciating pain to drink water. So I'm like, what's going on? So went back, and the pain just got worse and worse and worse and worse. And my boss didn't come in until like 9 o'clock. No, he didn't come in until 8:30. And I go to bed, work at 6 o'clock in the morning. And it started about 7:30. So I go back and start doing my job again, and I'm like, into the guard work. I'm like, oh my God, I can't, I'm in pain. Like, this is weird. Like, nothing was resolving it. So I was like, okay. So I went back to the bathroom, puked again, a little bit of blood, freak the F out. So I immediately went to my boss and I said, look, I have blood in my puke. I'm out. I'm leaving. Something's wrong. I'm going to the hospital. So I managed to drive. It was like 7 miles from my work to my mom's house. And at this point, when I'm getting out of the car, I'm bent over in pain. Like, I don't know if anybody's had gallbladder or appendicitis. All my family's had the problem. And that's how it was. So I get in my mom's house, and I was like, well, maybe if you just lay down, it'll subside. Well, for anybody that's had babies, you know that your contractions come and go. And no. This was 24/7, no relief. So my husband worked third, and he had came right after work to my mom's to pick up the kids. And he's like, why doesn't your mom take you this time to the hospital so I can sleep or whatever? And, you know, we figured he'll just give you pain meds and go home. So my mom's like, I'm going to take you to the hospital across the street, which is Dublin. And it's in my network of where I had my surgery. It's just Riverside's like 15, 20 minutes. And I didn't know if I could make it in the car that long, really. So I get to the ER, barely walk in. Excuse me. And I'm like, please, someone help me. Just help me. I'm dying, like dying, screaming, sweating. I mean, by the time I had gotten back to a room, my sweatpants, I wear sweatpants, of course I work in a cold room, they were literally sopping wet, dripping. Okay, so they called me back for pre-registration, and the lady's looking at me like, oh my God, she's really in pain. So I didn't even have to wait in the ER. They just put me into a room, and the doctor came in right away. Well, of course they think that you need, you want pain meds, this is fake, whatever. Excuse me. So I kept on asking for pain meds. And so they gave me Dilaudid, which Dilaudid sucks to me. I think it only works for like 5-10 minutes. And then well, they gave me the Dilaudid and Zofran because I was dry heaving like crazy. Didn't work. Dilaudid didn't work. So I am like screaming like, Mom, please, I'm gonna die. Like, seriously, please take care of my kids if I don't make it. Like, it was that bad. So they came in to do an ultrasound on my abdominal area. Motherfuckers, my abdominal area hurts. So literally when they put that little shit on it and then they put on your abdomen, I was screaming. And she's like, look, lady, if you want to refuse this test, you can. Like, being such a complete bitch. And then finally my mom was like, excuse me, she's in excruciating pain. I know my child. She's in excruciating pain. I'm sorry. Well, when she was going out, the lady going out, I said, I am so sorry for being a bitch. I am just in ungodly pain. I've never been in this pain before. And she's like, it's okay, that happens or whatever. So nothing showed on the ultrasound because they thought I was having, I needed my gallbladder removed. So the doctor was like, at the ER was like, I really don't want to give you another CT because you had one 2 weeks ago and radiation exposure is terrible and da-da-da-da-da. So I'm going to call your surgeon. Well, my surgeon was like, immediately get her into CT right now. So they took me right back to CT. They took, before when I went, they took like 15 pictures. They took 2 pictures on my CT. Well, now I thought that was kind of funny, but I didn't ask questions because I was in so much freaking pain. And I was dry heaving the whole way back